Hi, this is Lisa Schimmel from Crafton Hills College, and today I'd like to lecture on some bacterial diseases of the urinary and reproductive systems. All right, first on the list is gonorrhea, very common sexually transmitted infection. It's very underreported, as a matter of fact. Over 300,000 cases a year reported, but that is really just the tip of the iceberg. The actual number of gonorrhea cases could be as much as 2 or 3 times that number. Caused by a bacterium named Neisseria gonorrhea. You've got a photo of it, a gram stain of Neisseria in your outline, and you can see from that that it is a gram-negative Diplococcus. Now, this organism is very susceptible to cold and drying, so that means it isn't going to be able to survive for very long when separated from its host, for example, on surfaces. In the laboratory, it's a bit fastidious, and it's going to be grown on a type of media called chocolate agar. This is a type of blood agar, and in its preparation, the blood is heated, causing the cells to lyse and giving it literally a very opaque brown color. Looks very much like Hershey's chocolate in a Petri plate. The disease is diagnosed with either a gram stain of vaginal smear or sample taken from the penis. There are also a number of serologic tests that can be used to identify the organism. Now, one of the reasons that this disease is so common is that up to 80% of infected women may be asymptomatic for a significant period of time. That could be months or even years. And so while she's not really experiencing much in the way of symptoms, she is, anytime she has a sexual encounter, going to pass the organism on to her partner. Transmission, most often by sexual contact with a symptomatic or asymptomatic partner. The exception is a condition called ophthalmia neonatorum. That means infant blindness, and that occurs when a child passes through the birth canal of an infected woman. Now, because this is so common, and because it's so common for women to be asymptomatic, the eyes of all newborns are just automatically treated with a multi-antibiotic ointment. They used to use a silver nitrate solution called Creed's solution, but that's rather irritating to tissues, and so now we're going to use a multi-antibiotic ointment. The specific antibiotics are likely going to vary depending on the region in which we are working. Okay, let's talk about the symptoms when they do occur. In the male, we're going to see a 2 to 8 day incubation period, and then he's going to experience a fever, a discharge from the penis, and painful urination. Inflammation of the tissues is going to occur. This may result in scarring of the vas deferens, which are the little tubes that sperm need to move through to exit the body, and permanent sterility or subfertility is a possibility here. If for whatever reason this goes untreated, the infection can become systemic, spread to body organs and body joints. There's actually a form of arthritis that is associated with gonorrhea infections. Now, in the female, we're going to see, if symptoms do occur, or I should say when, we're going to see a discharge from the vagina, a fever, a burning sensation upon urination, and abdominal pain. Now, in the woman, complications can involve inflammation and scarring of the fallopian tubes. Again, permanent sterility or subfertility is a possibility. And and I wanted to mention that ectopic pregnancies are a possibility with this type of damage. Now, an ectopic pregnancy refers to a pregnancy that occurs in the abdominal cavity rather than in the uterus, and this is most definitely a life-threatening situation. Same problems with the woman. If it goes untreated, can spread to the bloodstream, resulting in septicemia or bacteremia. Those two terms mean the same. Organs, bone joints can be involved, and the woman may also experience what's known as pelvic inflammatory disease, or PID, and this refers to an infection of the uterus, the cervix, fallopian tubes, ovaries, any or all of those. Now, I don't want to suggest that gonorrhea is the only cause of pelvic inflammatory disease, because when the birth control device known as an IUD was popular, there were many cases of pelvic inflammatory disease that were the result of an infection of that device. Okay, treatment. Now, used to be penicillin was the top of the list, but resistance issues have developed over the years, and so cephalosporin is now the drug of choice. Okay, I'm going to take a little break right here, and we'll be back in a moment. All right, you guys, sorry about that little break. Let's talk next about syphilis, another very common disease caused by Treponema pallidum. Now, this one's a spirochete and it's gram-negative. Transmission of this disease can occur during the primary or secondary stages, and this typically occurs through sexual contact. And this would be referred to as horizontal transmission. I think you guys will recall we talked about that early in the semester. Vertical transmission from mother to child is also possible. This can occur at any stage of the disease, but it's most likely during the primary or the secondary stages. Now, the organism, because it is a spirochete, it's able to very easily penetrate mucous membranes and the underlying tissues, and that's how it enters our bloodstream. It may enter the circulatory system, be carried to any organ, any other parts of the body, and Treponema pallidum is very susceptible to drying, so it is not going to survive for very long when separated from its host. I mean, again, like I mentioned with gonorrhea, it's not going to survive for very long on surfaces. All right, now incubation ranges from 10 to 90 days, and then we will enter the primary stage of the disease, which is known as stage 1 or primary syphilis. What's going to happen after our incubation period is that a lesion called a chancre, it's going to form at the site of infection. It's a hard, rubbery lesion, usually painless, and the chancre is going to resolve and disappear after about 1 to 6 weeks. Now, the chancres are going to occur at the site of infection, and that could be on the mouth, rectum, on the genitals, and after another 2 to 6 weeks, the organism will have become systemic in its host. All right, now there are no silent carriers of syphilis like we discussed with gonorrhea. Anybody that's infected is going to develop the chancres. During the primary stage, we may see a 25% spontaneous recovery rate. What that means is that that patient's immune system was able to successfully eliminate the pathogen from their system. If not, it's treatable with penicillin. Large doses of penicillin will cure the disease. Now, if we were to test this patient during the primary stage of the disease, do an antibody titer test, they may show a negative reaction for that test. But make no mistake, they are infected and they are still contagious. All right, if the patient doesn't see a spontaneous recovery and if they weren't treated, we're going to progress to stage 2, which is the secondary stage of the disease. This occurs 6 weeks to 6 months after the chancres disappear. The organism has disseminated through the bloodstream and the lymph system.